And then from here, we're going to do a basic series for spine strengthening and to prevent and manage if you have back injuries. It's the most basic, but even if you're, highly accomplished athlete, just doing this series will help you feel more stable in your back all along the spinal column. So for me, this is kind of like my neutral spine position. When you set up on all fours, you want to be sure that you're not hyperextending like that or like rounding the back or the shoulders. So you shoulders, or you could say the wrists are under the shoulders, basically. The knees under the hips, and it's a little better for most people if you bring the knees a little more forward like that, so you can push your hips back a bit. Head position, the chin should be tucked in and looking straight down to the floor, but you don't want to engage the upper trapezius, so you bring the shoulders down from the ears and press the hands to the floor. Now, some people have shoulders that are internally rotated, so maybe they crawled, so they'll tend to do like this, like the hands kind of come in like that. Sorry for this view. And that internally rotates your rotator cuff joint. So obviously we don't need to do that. That makes the back get rounded. But other people, like a lot of women, have hyperextended or very loose joints. So when they set up the elbow, like the eye of the elbow goes way, like rotates way around. So the best position generally for setting the humerus in your shoulder joint is like this at a 45-degree angle. You have to be sure that you don't let your shoulders go up like that. So you just bring the shoulders down from the ears and then set your elbows at that 45-degree angle and press your hands to the floor. And at that position, you'll help set your rotator cuff, and it should feel like it's work. So we have a neutral spine position. We're going to lift only one arm or one leg at a time. When you lift the arm, it's best if you can externally rotate. So you can see my arm here. So it's not lift like this, palm face down. To move the shoulder blade, you lift like this. You go, arm is straight, slide forward, reach from the shoulder blade, and rotate so the thumb is out, palm up. Okay, so that's the goal, to externally rotate and upwardly rotate your shoulder blade as you lift the arm. We're going to hold each position 3 times for 5 or 10 seconds. We're doing only one limb at a time. This is like the basic series. Right arm lifting, slide the fingers forward, keep the chin in, externally rotate so your palm is facing up and thumb out. Hold. Take a deep breath. Always keeping neutral spine, arm down. Continue same arm. Imagine there's a 5-pound plate on your lower back, so you brace your lower back, right arm lift. Through the entire series, always feel that there's a 5-pound plate sitting on your lower back, arm down. That's the most important thing here in your lumbar spine. We want to brace, create stability, right arm lift, hold. Your lower back should not be collapsing. And for most people, like so often, right, when people arm down, try to take the pressure off. When people do the opposite arm and leg lift, like general bird dog, you just see the form just collapses all over. We want to strengthen the multifidi to keep the spine stable. So we're doing this more basic version. Okay, now set the arms. The next is the left leg. So get your set position, left leg, slide the toes along the floor. Don't just lift your leg, straighten your leg all the way, your foot is flexed, and then lift your straight leg using your glutes. Do not lift your leg when the knee's bent, and hold. Now here your hips should be parallel to the floor. So be sure that you don't let the hips lift up on one side, down and forward. Okay, and left leg, slide the toes back, completely straighten, glutes engage, leg lift without collapsing the lower back. Toes should be pointing down, no out toeing. Down and forward. Okay, so once more, left leg, slide the toes, straighten the leg totally, glutes, lift straight leg, hold. Keep the hips centered, don't shift to the right. Keep the leg straight, toes down, slide the leg forward. Okay, take the pressure. I know for a lot of people the wrists get sore. Okay, and now left arm. So set position, shoulders down, make sure the elbows are not hyperextending. Left arm, everybody brace the lower back, brace your abs. Left arm, slide the hand forward. Externally rotate, thumb out, palm up, hold. Your arm ideally would be straight the entire time. So when you bring the arm down, don't bend your elbow, keep the arm straight. Slide the arm back without bending your elbow. Brace the lower back, make sure you're not rounding or arching. Left arm. Always your body should be square and centered here, not leaning to the side. Once more, left arm. You don't have to lift it high. Some people won't even be able to move their arm much. That's okay. You just move in that direction, whatever you can do. Okay, rest. Then we'll take the load off your wrist for a sec. If you can't do this on the floor, you can do something similar, standing up at the wall. We'll do that another day. Okay, set position, shoulders down, press the hands, lower back bit of arch, you brace your lower back. Now right leg, brace your lower back, keep the chin in, right leg, slide the toes, straighten the leg, keep the foot flexed, glutes, lift, straight leg lift. Don't collapse on the right side low back. This is, I think, the weakest position for most people. Leg down, slide forward. You know, if you over rotate, you play golf, let's say, you swing and rotate on that right side all the time. Right leg, slide back, straighten glutes and lift. Make sure you're using your glutes. No falling over to the left side. Toes down. You should be looking straight down into the floor. Make sure you're not looking forward. Right leg, last one. Toes angled down, not out to the side, and hips stay level. Toes down, slide forward. Okay, that was great. Now from here, we're going to do side bend. So this is just a complete system, you know, doing all, so back strengthening, it's not just back, but it's also the sides and the front. You need all the dimensions around the spine to be strong. So next we're going to do a side bridge version. So today is basic, okay? Absolutely most basic. Like you have really bad back pain, your back goes out, and you don't want that to happen. So next one, you're just like this on the elbow. We'll start with left elbow. Knees are together, heels are together. And you just press the elbow into the floor. So if you're very weak in your obliques, what will happen is that the ribs will kind of go like that. So you need to engage the obliques and get the ribs up. That's the first step. If you can't do that part and you're trying to lift up or come up on one arm and all this stuff, you're missing the whole point. It's this muscle on the side of your waist, your obliques, that need to strengthen. Okay, now let's just switch to the other side. So this is the most basic, right? You elbow down, hips are on the floor, not even lifting hips. You just press the elbow to the floor, keep your head straight. Make sure you're not sagging down at the rib cage. So you just, for this, keep the hips on the floor. Next level is the hip lifting, but we do that on another occasion. So we're just doing about 10-second holds. And this whole series, I would just do 10-second holds. Okay, now from here, we're just going to lie right down. If you need a pillow for your head, okay, put something under the head. But this here, you're totally straight, and you have this hand for support, okay? Legs are together, heels together, legs are straight. You want to put your hand on your waist, so on the left side of your waist, you feel that? So that's the muscle. Those obliques are lifting your legs. You don't lift your legs using your leg muscles. You lift your legs using your obliques. So ready? Brace your obliques and lift. Now make sure the legs are back in line with your body. If you have your legs too far forward, you'll feel it in your quadriceps in the front of your legs. You shouldn't feel that. You should feel it in the obliques. And your legs are just like kind of hanging around. They're just not doing anything really. Not even your groin, not your quads, your obliques totally. Okay, legs down. And then we'll turn over to the other side. Legs are straight. Brace the obliques. And then lift both legs. And hold. And again, should feel it in the quads. If you do, just generally pull the legs back. If you feel it in your lower back, then you're using your QL, the quadratus lumborum, instead of your obliques. And so you just need to keep practicing this series to strengthen the obliques. Okay, legs down. So I would do that again 2 more times. So that just, yeah, so we'll go on to the left elbow. So the series we're doing today, if you have back pain and you want to help it out, you go just follow this video and do this series, the bird dog one, these side bridges. The bird dog you just do 1 time. The side bridges you do 3 times through. So we're going to do that right now. If you have pain and numbness down the arm when you press the elbow, then it will stabilize your shoulder joint. Okay, switch. The rotator cuff. Often, okay, so other side, right side, press the elbow. Just make sure the ribs aren't sagging and that you're square. So if you get numbness down your arm, that often comes from the pecs right here. Like you pinch the thoracic outlet. That's all the nerves and blood supply that go down the arm. So when you're here, this shoulder should be rotated back. You shouldn't feel, like right here, it shouldn't be tight. So if it is, you just want to think you need to keep the shoulder back, and you can obviously do more rolling out of your pecs. Okay, now lying on the side like this, brace the obliques and both legs lift. Just focus on using the muscles in your waist and not grabbing on with your legs. Oh yeah, the shoulders and neck also should be really relaxed, not participating at all. Okay. Very nice. Then we'll roll to the other side. Brace your waist and both legs lift. Often, like this tightness in the chest and upper traps, the upper trapezius, that's like the muscles at the base of the neck. That comes about when we're not using our core muscles or abs sufficiently. Legs down. So we're going to do a version of dead bug right now. So for this, and you see, if your muscles here aren't strong enough and you need support from here, then you'll start getting tension at the base of your neck. And when you do that, you'll tighten up the muscles and the nerves that go down your arms that contribute to the tingling, okay? So the position of the arms is to the sky. Bend the elbows like that, 90 degrees. So you see the elbows are over the shoulders and it's like totally comfortable. There's no tension neck, no tension shoulders. So that should remain consistent. And then when you lift the legs, knees over hips, here you should feel your abs, not tension in your neck, not tension in the shoulders. So now we're going to use that base. Just keep relaxed with your shoulders. And right leg, push it forward away from you a couple of inches and hold it there. The lower back should have a bit of an arch, shouldn't be flat on the floor. Right leg back, left leg a little forward. Hold. And if you straighten your leg too far, left leg back, right leg a little forward. If you put your leg out too far, what you'll notice is you'll use your thighs, you'll use your quads. That's another compensation for weak core. Right leg back, left leg a little forward. People often will use their quadriceps and bypass the abs. So here we're really trying to get abs engagement and lower back, a bit of arch, shouldn't feel it in low back, left leg back, right leg a little forward, hold. So your legs are just very relaxed, but they're in position correctly, left leg a little forward. Another cheat is pulling your knees closer to your chest. Okay, so knees are over hips. If you bring them to your chest, you know that tips the pelvis, flattens the low back. And again, you just lose the control of the abs, and you'll use your legs instead. Okay, and just relax. Then last thing again is you do this wide position with the arms, and that will release the tension and get better blood flow and help the nerves down the arms. Okay, so from there, Now we're going to start our weightlifting. So to get up, you know, I like to roll to the side. And you can get up in your lunge position. Or